Hi, and welcome to our Facebook Live. I'm Dr. Larry,
And I'm Dr. Tiffany.
and we're the doctors of Nova Pediatrics. And we're here again talking about returning to school during COVID-19.
We're also going to talk a little bit about returning to childcare and a little bit on swimming pool safety. But we will first start talking about returning to school during COVID-19. I know this is a question on the minds of many parents today. Different school systems are asking parents to make decisions within the next few weeks, and so we're going to try to give you some guidance and answer hopefully some questions for you.
We're practicing our social distancing here, and
Right.
so we're going to take our masks off so you can hear us a little better.
That's right.
So, a big question many parents have right now is what can we do to keep our kids safe when they go back to school? And so, this is a confusing time, and Fairfax County schools are opening up with choice of either having 2 days of school, either Tuesday, Thursday, or Wednesday, Friday, and Mondays are going to be a teacher work day, or the other alternative is doing distance learning 4 days a week. And I know, Tiffany, you have kids, and so
You're
you're
right.
making that decision now
Yes,
too. So
yes, we have to make our decision in the next week. So just some background here. The American Academy of Pediatrics, actually advises to send children back to school. So there are many benefits for children attending school, not just learning math, reading, and science. There are mental health benefits, there are nutritional benefits, there are exercise benefits. Many things kids get from school that they can't get from virtual learning. So as much as possible and in a safe manner as possible, kids should try to return to school.
So, what do schools need to do so we can learn some lessons from the uh, daycares that have been open during COVID and they've been practicing some safe social distancing, physical distancing with the kids? There was a really good tip called making the airplane arms. So if you put your arms out all the way, then we're 6 feet apart between kids, and they were taking temperatures on the forehead with
Mm-hmm.
everybody entering the school, and everybody was wearing their cloth masks.
That's right.
And so, hand washing and then spraying everybody's hands with the alcohol sanitizer upon entering, these simple things really decreased the amount of spread and allowed these preschools and daycares to be open.
That's right. And and for schools too, for mask wearing is encouraged for kids 3 and above. So kids 2 and under, we worry about a suffocation risk, so we do not want them wearing masks. So just keep that in mind. But masks have been proven to decrease the spread of the COVID virus.
Now, there isn't a lot of good evidence regarding this 6 feet versus 3 feet apart. I spoke to our Dr. Ben Schwartz, who's head of the Fairfax County Health Department and boarded in infectious disease and pediatrics, and he aptly says that 3 feet apart is good, but 6 feet apart is twice as good. So keep that in mind and avoiding the close contact. He said also being outside on the playground really isn't a risk when they're playing outside, so most likely they wouldn't need to wear masks when they're outside.
Right, and they're encouraging the Academy of Pediatrics. You may see some reports coming out of the 3 feet. That's why we're bringing this up, because the American Academy of Pediatrics has mentioned 3 feet is a good distance, but just keep in mind 6 feet is twice as good. And they've also recommended that when kids are out on the playground, that they're out in small groups, right? So they go out in small groups versus the large groups in the past.
And a lot of these preschools and daycares keep kids together as what they call a pod. So it would be usually under 10 kids together, all with the same teacher, all doing the same things, going inside, outside. So again, minimizing the risk. the risk is really magnified when you're with crowds. So if you're in a big cafeteria with hundreds of kids, so eating at your desk, eating your
Right.
lunch separately, not sharing your lunch, these things will be important. Also, activities like singing and exercising, where you might be really
Expelling that virus.
expelling the virus out, that is a higher risk, and so should certainly, wear a mask during that time or be at least 6 feet apart during those things.
That's true. And so many of these school systems are um, putting in as part of their policy that students will remain in their classroom and the teachers will move
Hmm.
to the different classes so that the kids are not mingling lots of kids in the hallways. They're also encouraging kids to eat lunch in their classrooms so that they don't go to this large cafeteria with big gatherings of
Hmm.
people. So
Now, some additional considerations. There may be some high risk kids that you as a parent decide that it's really best either to homeschool or to do the virtual learning, and that's certainly your right as a parent. Um, if you have a grandparent that lives with you that's over age 65 or might be immunosuppressed or on medications for cancer, then that person uh, gives a higher risk uh, for COVID, and it may necessitate you keeping the kids home.
right, doing the virtual learning at home. And then just keep in mind, as we go through this, the fall, COVID may come back in our area, and so schools may close again. So schools are going to have different plans and contingent plans. And parents need to have backup plans too in case the schools close. What are they going to do if the schools
Yes,
close?
you may have to have a babysitter hired. You
Right.
may be able to get a tutor for your children. Uh, Possibly small uh, groups of kids could be homeschooled with a teacher or tutor. So you have to really look at what the best options are for you and your kids.
That's correct. And we talked about temperature checks, and it's very unlikely and very difficult for schools to do temperature checks of large groups of kids. So that's probably not going to be, unfortunately, part of their plans. But the parents need to be very aware of their kids. And obviously, if a child is sick, has fever, has coughing, vomiting, diarrhea, really does not should not be sent to school. And I know a lot of times parents, if a child's mildly sick, they'll still send them. But really, in this environment, if your child's sick, really he or she needs to stay home.
And then flu season's going to be coming up, and I know we'll be doing the flu testing in our office as well as the COVID testing. And the flu and COVID are oftentimes very difficult to tease apart. And so if your child has, fever, cough, runny nose, please, call the pediatrician, keep them home. It's not only your own child that you're worrying about, it's everybody else at the school. And even a low grade temperature. The definition of a fever, as we as pediatricians always know, but you might not know as a parent, is anything above 100.4 degrees. And so that might seem like a low grade temperature, but we take that seriously. And if there are other respiratory or even gastrointestinal, GI symptoms going on, that can also be a sign of COVID. Sometimes kids can be asymptomatic or really very mildly ill. So that's actually a good thing for kids, but then it makes it a little tougher to
That
diagnose.
is correct. And more than ever, folks will want to get their flu vaccine this fall to protect them
Absolutely.
from that. So, um,
We should be getting that in September, so please, let our office know, and we'll be having, the flu clinics and getting everybody
absolutely.
immunized. The good news is we're seeing more and more of the kids coming in for their physicals now, for school, for college, for high school, sports, hopefully, if there are sports. But our office is open, and thankfully, we're seeing more and more come in for their physical and get all their vaccinations.
That's right, absolutely. And we do hope, and I believe they will. The schools follow the CDC recommendations for cleaning and disinfecting the schools. Um, there's talk, obviously, of, as Dr. Seidman said, of doing the alternate days where students are going in person 2 days a week, and then one group goes 2 days and another group goes another 2 days. But intensive cleaning will be going on after the school day. So that's something too. Is that the cleaning and disinfecting is going to be very important for the schools.
I think a low-tech way is if you just carry or have your child carry a small the alcohol hand sanitizer, spray the hands when you're going in, when you touch any surfaces, and that's something when you go into many of the restaurants and stores now, you're lining up outside and spraying the hands. I do hope the schools implement that along with temperature, and so please, speak to the teachers, administrators, the board, and so now they're working on policies that you can be involved with for the safety of your kids.
That's right. So as your children are going off to school, obviously you want them to bring with them their mask and their hand sanitizer. So two things to travel with nowadays. And another thing too, buses, right? Busing
Right?
is going to be a very
Challenging.
challenging thing to have to deal with. So bus riders, suggestions from the Academy of Pediatrics is bus riders being assigned seats, and obviously wearing their masks on the bus and alternating seats so that kids are spaced out. At the very minimum, half the number of usual kids, and maybe even a third of the number of usual kids will be riding the bus at one time,
Hmm.
so that they can space kids out. Um, Another suggestion was to have hallways in the schools marked for one-way directions,
That's good.
so that kids are not, going in all different directions, but as they've tried to do in grocery stores,
Right.
but to and stores is to try to mark one-way directions in different hallways. Um, and as we said before, having kids stay in their assigned seats for meals and stuff too. Um, and then small groups on the playground. So all these things that really have to be part of policies, and schools are working on to try to keep kids safe, and adults and the teachers safe too. Absolutely.
We realize that the kids feel a lot of pressure. They feel pressure from being home and cooped up. They feel pressure from watching the media and maybe having family and friends that may have suffered from COVID, and then they're feeling pressure to catch up.
Right.
So this last marking period, last semester in school, there really wasn't as much gains from the distance learning. So please have your kids read over the summer. As I tell the kids, when you kick a soccer ball, you're exercising your leg muscle. When you're reading a book, you exercise your brain muscle. All the electronics, it turns your brain to jello. But if you want to get a strong brain, read a book. And you can do that over the summer and make up for some of those deficits from uh, the school year. We really, as parents, are going to have to pick up the difference because kids just 2 days a week and just left to themselves for the other 3 days, it's not going to be enough.
Right.
So we will have to work together, as small, uh, groups of parents and work with either the tutors or other parents in your neighborhood that might have experience and in certain subjects and really take it upon ourselves to educate our kids.
Absolutely. And in addition to the reading, or part of the reading, school libraries now are actually, school libraries, public libraries are having online access to books. So maybe unfortunately you can't go into your libraries over the summer, but you can access things online, which is a good thing. And some schools are also offering math and language arts review stuff online. There's lots of free
Hmm,
things that didn't used to be
right.
free, but now they're trying to help kids catch up. So,
And
so
there's the
just
Khan Academy too.
yes,
That is
sure.
a great resource if you haven't checked that out, especially for kids in the high school level grades that you may not be versed in the calculus and chemistry, but they have a
Right.
full curriculum there. So that's
Absolutely. And
another.
many groups are advocating for kids not to be tested in the fall, because they really need time to catch up. So taking that pressure off kids that they don't need to be where they normally would be at this time.
It's important to balance the core classes with some physical exercise to let the kids blow off steam. They can ride their bike, they can, run around the neighborhood. We'll be talking about the pools being open, and so really having the good physical health, mental health, making sure they sleep and get a good 8 hours rest. Take the electronics out of the bedroom. Make sure that they're getting that 8 hours sleep and they're just not on the internet and computer and the Wi-Fi and gaming all night long. They really have to monitor that, especially older kids as they get up into high school.
And trying to keep them on a routine. I know it
Good.
seems difficult, but if their routine, they're staying up till 3 in the morning and getting up at noontime. You want to try to keep them on somewhat of a routine. Um,
Yeah, teenagers left to their own device would be on a 25-hour schedule. So that means every night they would be going to bed an hour later until they totally get out of phase. So keeping that routine during the summer, these next 2 months, will help them once they get back to school in the fall, especially for the older kids, high school and college kids especially.
That's correct. And then another thing, we kind of touched on this, but students with disabilities, closed schools may really have impacted them negatively. They probably were missing out on the services that they receive from school. Some kids may receive some services, but they may have been missing out on occupational therapy, physical therapy, speech and language classes. So, we're going to have to transition, these kids are going to need to be transitioned into a regular school routine in the fall. And many of these kids may still need to stay virtual, but these also may be the kids who really need to go back to school to get their services also. So that needs to be discussed. Parents need to discuss that with their school too.
Right, and as you alluded to, the Academy recommends reviewing the needs of each child with an IEP, that's the Individual Education Program, before they return to school and start services, even if it's done virtually. So reach out to the school and to see when that can be done.
And yes, if your child has an IEP, make sure you're advocating to make sure that that's being reviewed and it's enforced. So
And the AAP, the Academy of Pediatrics, encourages everyone to see their pediatrician for annual checkups. As you said, Nova Pediatrics has been open this whole time, and thankfully we're getting back up to our full pre-COVID physicals, and we're giving the immunizations and catching up. We also still have our tent available outside, and we can set that up for those that feel they don't want to come into the office properly. However, it's been quiet. We schedule by appointment only. There are no big crowds. We have the door locked. We buzz you in. We take your temperature. Everybody has masks. The rooms are all cleaned. We take every step to make sure that kids stay well and caught up with their vaccines and their physicals.
and don't forget about the sports physicals.
Right.
We still are doing many sports physicals. There may be some sports that really do continue in the fall, and so please take this time to come in for sports physicals also.
Right. Probably there'll be track and soccer, I imagine.
Things that can space
Yeah,
golf, tennis,
right.
things that can space do social distancing will still continue. And so mental health is very, very important, right? And so um, obviously, even before COVID, teenagers were having trouble with anxiety and depression, but COVID really this pandemic has made the stress level so much worse. And so it's very important. Schools actually are also a part of that support system and help identify children and give them resources. So schools are there also to help, but we also want to make sure that parents are aware of children who are suffering with sadness and anxiety and worry.
And if your child seems withdrawn, uh, isn't communicative, doesn't seem to have friends, has a sense of melancholy, please call our office. We do screening for anxiety and depression for all the kids coming in for their physicals. But certainly, if you have a question as a parent, please let us know.
Absolutely. And another role that the schools play for many, many students and families is nutrition. So many children receive meals, 1 to 2 meals a day through the schools. And schools, even when schools are out or schools are doing virtual sessions, should still be providing the food for these kids. And I know Fairfax County does different meal programs where they have meal drops at different bus stops or in different locations. So really, that's just something to know that's out there, and that just another benefit for schools.
Our next topic was returning to daycare, and many parents ask, is it safe to send my child back to the daycare? There have been daycares open that have been successfully
Yeah.
taking care of the frontline workers, and we have a good article that is posted on our Facebook page, and please take a look at this, what parents can learn from child care centers that stayed open during the lockdowns. I think it's some really good tips. The one I thought was really cute was, in order for the preschoolers to wash their hands, they stamped them, and they said, oh, you got to wash your hands to get the stamp off before you can go to the next activity.
And so scrubbing, right? So they have to wash very well to get that stamp off. So.
And the other thing was, as we mentioned, making the airplane arms when they're in line down the hall, so that way it's fun for them, and then they can see that they're about 6 feet apart. Those two things were
so being creative is a great way, especially with younger kids. They enjoy playing games like that, and they can be very compliant in doing these cleaning procedures if it's a fun way to do it. So a question. So parents should be asking their child care provider, whether it's a big organization or a small home daycare, whether they're following the CDC cleaning guidelines, right? So that these are questions you need to ask. Are you following cleaning procedures? Are you cleaning all the toys regularly? Are you screening the children who are coming in that day? Do they get their temperatures checked? Do you ask the parents questions? Have they been ill? Do they have a cough, a fever, vomiting, diarrhea? So you want to know what the procedures of your child care provider are. It's very important.
And if you're in a daycare, do they have a policy if a child is tested and is sick for returning? And if they're positive, how long do they have to stay home? Do they need a negative test to come back? Do they have an isolation room for a child to go that has sickness or fever until mom or dad picks them up? So these are all things to ask ahead of time, and maybe pay a visit and see if they're open now, what policies they have in place.
Right, and absolutely, and also ask, do the providers at the child care facility, what happens if a provider is test positive, and what's the facility's policy for that staff member returning to work? So all these questions you want to know from your child care provider. And some of the routines you also want to know from your child care provider. How do the children take naps? How do they line up the cots or the mattresses or the beds? Ideally they should be asking every parent to bring their own materials for the child to rest on, right? You don't want to be sharing any blankets or pillows or anything.
Sharing.
No sharing.
We teach our kids to share, but this might be hard for them to understand. Mommy, you told me I got to share, and now no sharing. So it may be hard, but we have to reinforce that, and then allowing them time to play outside, burn off some of that steam. So when they're indoors, also consider opening some window, allowing some ventilation to come in.
Right.
And so these are some tips. Keeping the kids apart. Oftentimes the young ones want to hug each other and be in each other's face, so it's hard. It's really difficult.
It is very difficult. And the Academy of Pediatrics suggests that cots or beds be lined up opposite, so that one child's head is opposite from another child's head, so they're not sleeping face to face.
So you need to have a backup plan once the school's open, and they may close again. So have that plan in place. For our last 5 minutes, we want to just discuss a little bit about going to the pool. I know our pool
Absolutely.
in Springfield opened, and they actually have a very good plan in place where they only allow 25 people at the pool at one time. You have to sign up, and you can only get one 2 hour block of time every 2 days to make it fair.
Hmm.
And so they're checking, everybody's temperature when coming in.
Yeah.
There's no pool furniture, no chairs there. Anything left behind is thrown out.
Mm-hmm.
So they've been, very good about that. So again, in speaking with Dr. Schwartz regarding the pools, it's not the pool water specifically. You might think about not
Mm-hmm.
going into the kiddie pool. I think most kiddie pools aren't going to be open, but in the big pool, if you're in and out or you're swimming in the lane, you're not crowded on top of
Mm-hmm.
another person. It's really the crowds. Each additional person that you add increases your risk. So keeping the numbers down really is the best policy.
Right. And the other thing is, from what we know scientifically, is that if you're moving, so swimming fast, swimming past each other, not gathering in a group, you're much less likely to spread the virus if you're moving and you're not staying in one place,
Right.
face to face with someone.
It says worry less about the water in the pool and more about the person standing next to you in the crowded locker room.
Right.
So that's another area to really consider, that they should have some social distancing or people go into the
Right.
locker room one at a time.
And of course, wear your masks.
When
If
you're
you are over, 3 years or
right,
over, wear your mask when you're in a locker room or
right.
in a place where you cannot stay 6 feet
It may
apart.
be obvious, but you don't need to wear your mask in the pool, but it's
Absolutely.
around the pool. And if there are no chairs, I don't think there'll be people, congregating.
Right.
There's no place to
Right.
sit.
And just to keep this in mind, you definitely do not want to wear your mask in the pool because when the mask gets wet, it actually can be a suffocation risk because you can't breathe through a wet mask. So please don't try to wear your mask in the pool.
No guests are allowed in our pool. There's only about two swimmers allowed in one lane if they're swimming laps. No chairs allowed and masks in the locker room. Hand hygiene, obviously, spraying with the alcohol spray, washing the hands before and entering the pool. Chlorine in the pool, as you know, it's bleach and it does kill the
Right.
virus. Couple uh, things that if it's rained the night before, it is again harder to chlorinate a pool. And if there is a lot of sunshine, that does burn chlorine off the pool. And if there are multiple people in the pool, that also does affect the ability to properly affect the chlorination and the pH balance. So these are things that you should, speak to the manager at the pool, make sure they're frequently testing the
Right.
water.
That's correct. And then, and this is an obvious thing, but just be very, aware. If you or your child is sick, obviously stay home. Do not go to a pool with any sign of an illness. And that meaning a fever, 100.4 or higher, a cough, any vomiting, diarrhea, you just don't feel well, unusual rashes, please do not go to the pool. And they say, and of course, if you've been exposed to COVID within the last 14 days, please do not go to the pool.
And just a timely message, we want you all to have a safe 4th of July. If there are fireworks, please, you know, watch your child. They shouldn't be, lighting things themselves. I don't know if there's going to be groups of fireworks this 4th of July. If you have the hand sanitizer, realize it's alcohol, it's very flammable, it doesn't go with any flame or fireworks.
So
So please,
keep your hand sanitizers away from fireworks.
absolutely.
And we, unfortunately, in our practice, we over the years we've seen many injuries from fireworks. So eye injuries, hand injuries, arm, leg, feet injuries. So please be very careful about keeping your children away from live, active fireworks.
Oh, we have a question from our audience. So, should kids share supplies while they're in school?
So
That's actually
actually,
a very
that
good
actually
question.
was addressed in this article that we have posted. But actually, one of the ways that they kept down infection is that kids had their own supplies in school. So no sharing of supplies. Really, kids should have their own supplies, and that will also keep down your risk of spread of infection.
Very good.
Again, I'm sorry, but you'll have to start emphasizing to your kids no sharing right now. Maybe in the future, but not currently. We should be sharing.
Well, I'm Dr. Larry.
And I'm Dr. Tiffany.
And we're the doctors of Nova Pediatrics.
And we're here for your children. If you have questions, obviously please call us. We're still doing telemedicine visits. Telemedicine visits work very well for conferences or behavioral concerns or anything you want to kind of discuss on a longer discussion time. And we're obviously still doing our annual physicals, and please remember to schedule your physicals, your regular annual and your sports physicals for your children this summer.
Yeah, and please be safe this weekend with the 4th of July.
Absolutely.
And have fun out there. Sunscreen, sunglasses, water safety, all the basics.
Yes.
So have fun, be safe, and we'll see you next time.
And stay tuned for flu vaccine in the fall. Great.
Good job. What do you think?
That's great.
Thank you. No, that was good. That's a
We're
lot
like
of
Abbott
good.
and Costello.
I know, right? It's a lot of good information.
Yeah, we got a lot of information there. We
good stuff.
did that.
Who put that together?
Tiffany, the night before, like on Wednesday.
Yeah, I started it, and then I made some. Yeah, I made.
Would you like a
stuff.
copy? You can take to your kids,
I
and
totally
so
It needs a little. There's a couple tweaks after we talked, but this was.
And
And
this article
Alethea
is
sent
really
us
good
this
too.
good article.
Yeah.
And
I saw that online somehow. I don't know how I arrived
The
at
New
it,
York
but
Times has really put out
really
some
good.
amazing things recently, right? Since COVID, so I don't know.
Ooh, it says end live video again.
We're supposed to save.
Oh.
Remember save? He said to save.
Let me see if you end. Choose.